This is Due South on WUNC News. I'm Jeff Tiberii. Summer heat and humidity continues to climb to new heights with far-reaching implications.
Higher humidity, higher overnight temperatures, or more persistently high overnight temperatures, which actually has a significant impact on people and our infrastructure. Almost every aspect of our society is impacted by this.
This hour, we're learning about many of these aspects, from health to agriculture to initiatives, both good and bad.
The city of Raleigh, for example, does that. So when there's particularly high heat days, they may modify, for example, waste management or trash collection services so they're not collecting trash and they're not doing routes on the hottest parts of the day to protect workers.
Due South talks heat. First, the news. From the American Tobacco Historic District in downtown Durham, this is Due South on listener-supported WUNC News. I'm Jeff Tiberii. It has been a wet month. Central North Carolina has not seen this much rain in a single month in almost 2 years. And while it is a bit cooler recently, heat is almost always lurking during our Carolina summers. In a bit, two scientists on the impacts of heat in our changing climate.
We may not see huge increases in daily air temperature in the southeast like we will in the southwest. What we will see is incredibly high humidity in these areas, which combined with higher air temperature is very difficult on the body.
First, a conversation with an emergency medicine expert about what heat does to the body and some of the warning signs to be aware of. Here's Leoneda Inge.
I'm here with Dr. Lauren Siewny, Medical Director of the Duke University Hospital Emergency Department and Assistant Professor of Emergency Medicine. Welcome to Due South.
Thank you so much for having me.
Well, Dr. Siewny, why is heat problematic for us? I admit I didn't start really paying attention to body heat until I had a bouncing baby boy 28 years ago. And if his temperature topped 100 degrees, I was very, very concerned. And then whenever we would go outside, it didn't matter the time of year, I was like, oh, we need a hat. We need a hat. So what does heat actually do to the body?
Yeah, and I know it feels like everywhere you go right now, people are talking about heat. I know every venue I went into in the last 2 weeks, people moved it inside because it was just so hot outside. And you bring up a good point about the difference between heat when, for example, an infant has a fever versus heat when it's environmental insult to the body. And really, it's two different things. What happens when it's hot outside is your body's internal temperature regulation system just isn't able to keep up anymore. Normally, the system works very well, but when it gets particularly hot outside, and especially in particular that heat index gets really high, the body is working really hard to try to bring that temperature back down, and it's just not able to keep up. It's kind of like your car engine does similarly, that it's trying to constantly maintain a normal heat while it's constantly putting heat off. But if you stress it too much, then it's just not able to keep up, and the temperature will go up.
Is that when we get to the point of like a heat stroke?
Yeah. So what happens is as the body's internal temperature reaches uncomfortably high levels, it impacts all of the organs of the body. And I think that what we're learning more and more is classically we think of things like heat stroke, which is referring to the brain experiencing the impacts of heat. But what we've learned is that heat really impacts all organs. So heart, lungs, kidneys, muscles, really the entire body. But we call it heat stroke. This is a little bit of a fun fact, but stroke comes from a Greek word, apoplexy. And what that means is a sudden attack or collapse. And so rather than meaning stroke like we think of typically, that a blood clot in the brain, this is more referring to heat stroke can be a sudden collapse of the body's thermoregulatory system, resulting in very high temperatures and potentially things like brain damage.
What are some of the symptoms? Is that different from heat illness?
Yeah, so good question, and this is really important. Heat illness describes the full spectrum of what can happen when you get exposed to heat. On the less severe side, there's things like heat cramps, heat exhaustion, and this is things that maybe many of us have experienced. So sore muscles, weakness, nausea, vomiting, profound sweating. I know I experienced this as a kid on a hot tennis court, and I could feel that tunnel vision setting in. I felt like I might pass out, and at the time, I had no idea. Of course, this was heat exhaustion. But looking back on it, I'm so grateful to the coach recognized it, got me to the shade, put some cool ice pack around my neck, and I was better after a few minutes. But so that's heat exhaustion, and that's the right thing to do when you experience those symptoms. But it can progress to a 911 emergency, and that is heat stroke. And the symptoms of heat stroke are going to be confusion, maybe passing out, and in an extreme event, seizure, unresponsiveness, coma. But really, the first sign is that altered mental status. And that is a 911
When you see someone that's sort of really dizzy and disoriented. So who are typically the most vulnerable to heat? Are they the little ones? When I think about my babies, I was paranoid that they would get too hot because I grew up in Florida, so I'm like, okay, you got to keep them out of all that humidity and that heat. But who is most vulnerable? Is it the little ones or the old ones or anybody?
Yeah, you're totally correct. I think to start with, we think of those traditional at-risk groups. So that's going to be, yes, children and the elderly and people who are pregnant, people who are working outside, people experiencing homelessness, athletes exercising outside. Those are kinds of the populations that we talk about a lot. But one thing I'd like to bring up is we don't talk enough about that people with chronic illness and even regular people that are healthy going about their daily lives can be at risk for heat illness. And this is because up until recently, there was this under-recognized fact that heat illness, while can present as sort of an acute stroke-like symptoms, it can also have be the effect of a cumulative impact. So if you're somebody who has, say, a chronic illness like chronic kidney disease, if we have several days in a row of high heat, then that impact on the kidneys can build. And if there's not time to recover in between the insults, then that's what can really lead to dangerous situations.
So what can people do to really prepare to go out into the heat and the sun? It's the time of year. We love to be outside. I mean, how much water do we need to drink?
So water is very important in maintaining adequate hydration. That's always going to be the most important first step. And actually, I call it like pre-hydration. So drinking water before you know you're going to be outside at a family event or a concert or exercising or whatever it might be. Water's always best. Things like sugary drinks and alcohol may even contribute to dehydration. So water's going to be what's best. But I think water and hydration is only one aspect of what we can do. There's plenty of other things that can be hard because they require you potentially rearranging your life. So things like moving events inside, changing the time of an event so that it's not at the peak heat times of day, changing around. Maybe you wanted to wear your favorite outfit, but you could switch it out for something that's cooler, lighter materials, and thinking about how you can have opportunities to seek breaks, whether it's in the shade or ideally the air conditioning. And that's going to be really important. I know over the July 4th holiday, I had a family event up in Ohio, and we had to relocate it indoors because it was just simply too hot for anyone to be safe outside.
When I think of the emergency room, I mean, tell me about the folks most of the folks that are coming in, and what symptoms do they have?
Yeah. So in the emergency department, we're definitely seeing an increase in presentations for heat-related illness. And it's an interesting thing that's hard to wrap your arms around because people don't come in with a label that says, I have heat illness. They come in with weakness, shortness of breath, dizziness, nausea, vomiting. And it's our job as physicians to tease apart what is heat illness versus what could be something else versus is it both. So what I can say is that we are seeing more people coming in for heat-related illness and earlier in the season too. So it's becoming, I think, I've lived in Durham for 13 years, and it used to be that we would see this more July, August, and it's that heat season is prolonged, and it's prolonging heading into earlier months, even May and June now sometimes, which can be hard because usually that early in the year, people aren't prepared to face high heat temperatures. Maybe their air conditioning's not set up. Maybe our community cooling centers aren't activated yet. So we are seeing that in the emergency department. I think we see the full spectrum. So we do see a lot of people who have heat exhaustion, and again, for those people, things like cool fluids to drink or in an IV, ice packs to the neck, armpits, groin, that can all help. And we do see that. And often those people are able to go home after a period of observation. But then we also see true heat stroke. And that can be, that's an all-out emergency. What you can expect to see if somebody comes in for that is an immediate addressing of the high temperature. We check your core body temperature first and then react based on that with aggressive cooling measures up front. And then typically those folks would be admitted to the hospital and potentially even to an ICU.
Well, it's a good time to check on your neighbors, your friends, your children who are outside a lot these days. Dr. Lauren Siewny is medical director of the Duke University Hospital Emergency Department. Thank you so much for your time and expertise, and stay cool.
Thanks for having me. And yeah, please look after each other. That's the number one thing that we can do in these high temperatures.
Still ahead this hour, two experts describe heat concerns in urban and rural areas, the disproportionate impacts of extreme heat on certain populations, and possible solutions to help protect all of us during these dog days of summer. I'm Jeff Tiberii. More Due South in a moment, right here on WUNC News. Welcome back. It's Due South on listener-supported WUNC News. I'm Jeff Tiberii. This week has been unseasonably cool. Still, summer here in North Carolina is hotter than it used to be, with record temperatures, dozens of days that have a heat index in the triple digits. This unrelenting heat takes a toll on our bodies, as you heard earlier in the show today, as well as on our bank accounts and on our communities. We welcome now into our studios two leaders and scholars, each who is thinking about heat and its deep impacts, which populations feel it most, and how to creatively address the effects of extreme heat in our North Carolina communities and beyond. Angel Hsu is director of the Data-Driven EnviroLab and associate professor of public policy and environment, ecology, and energy at the University of North Carolina at Chapel Hill. Also with us, Ashley Ward. She is the director of the Heat Policy Innovation Hub at Duke University's Nicholas Institute for Energy, Environment, and Sustainability. Angel, Ashley, welcome to Due South.
Thanks for having me.
Yeah, thanks for having us.
All right, a basic one to start here. What are your best practices to avoiding, dare I say, beating the summer heat? Angel?
Well, I think the number one thing is to stay indoors and keep that air conditioning pumping. So I think that's probably the number one thing, is to try to limit your exposure.
Okay. Ashley?
Sure. So just to build off of that, I would definitely say limiting exposure. But what happens if you can't afford your air conditioning in your house or you don't have access to air conditioning? I think my number one thing is to think about how you can efficiently use cool water outside your body to cool your core body temperature. Things like getting in a cool shower, soaking your feet or your arms over your elbows. These are ways that we can mitigate the impact of extreme heat on the body in absence of air conditioning.
I want to ask about air conditioning a little bit, but let's first define or establish how you scientists think about what is extreme heat? Just put a box around it or some parameters. Ashley?
Oh, I was going to actually let Angel answer this first, but I'll go
Angel,
ahead, I guess.
Yeah, well, as a scientist, I'm going to equivocate and say that it's really difficult to define what you mean by extreme.
Okay.
So I teach data science classes. I work a lot with statistics. And I mean, generally, you can think about extreme as being 2 to 3 standard deviations. Now we're talking about 3 standard deviations away from the average of what a typical day might feel like in the summertime or in the daytime or whatever period you're considering. But there's a lot of different factors that go into this definition of extreme heat. But generally, what we're seeing is that temperatures on average today, just give any summer day, are going to be warmer than they were a century ago or even 30 years ago or even 20 years ago. And so, depending on what time period you're considering, what we're looking at is that we're seeing also the probability of more extreme days occurring, extremely hot days occurring.
And I'm not trying to be a smart aleck here, but if the average was 89 and now the average is 98, maybe extreme isn't the word. Maybe it's become more normal, but it's harder on the body than it was a generation or a century ago. Is that a fair way of thinking about it?
Yeah, I think you could say that. I think if we look globally, we're seeing that temperatures are about 1.5 degrees Celsius warmer than what they were before industrial levels. And so before, 300 years ago, we're seeing that temperatures on average are about 1.5 degrees Celsius. That's about 2.2 degrees Fahrenheit warmer than they used to be on average.
Just to be clear, I was not trying to imply that we've seen 9 degrees jump in a century. Noted here.
But actually, that's a global average. And so if you think about looking in more detail, there's also some places that have warmed more than 1.5 degrees Celsius. And so there actually have been places on Earth that could be 9 degrees Celsius or Fahrenheit on average warmer than they were 50 or 100 years ago. And so it's actually not wrong to say that these global averages, they may not seem like it's really scary because that's true. There are some places, particularly on the Arctic pole. So if we're talking about the extreme parts of the Earth where they receive a lot more direct sunlight, those areas actually have been warming up a lot faster. Sorry, they don't receive more direct sunlight, but they have been warming faster.
Let's winnow it down if we can. I don't know who is better equipped to answer this question, but for central North Carolina, for the Piedmont, this middle third of our state, what can you tell us about extreme heat or the change in what has become more normal in, let's say, the last 50 years? Ashley, do you want to take that one? Yeah, go ahead.
Yeah, I mean, so I think whenever we talk about extreme heat, I think it's important to think about extreme heat relative to what, right? So this is what Angel was trying to get at, is a lot of it has to do with what historically has been the experience. And this is not just for people, but this is for our society writ large. All of our infrastructure is geared around certain temperature thresholds. The steel that's in the Northeast is different than the steel that's in the Southwest. So when we say extreme, it always is extreme relative to the baseline of where you are. In central North Carolina, one of the things that really distinguishes the Southeast writ large, central North Carolina is certainly one of them, is not only air temperature, which is what you've been referring to, but we may not see huge increases in daily air temperature in the Southeast like we will in the Southwest. What we will see is incredibly high humidity in these areas, which combined with higher air temperature is very difficult on the body. And the next thing that I think people should really pay attention to if you're worried about your own well-being, right, is persistently high overnight temperatures in central North Carolina. And we've already seen that, right? This is where the overnight temperatures fail to drop below 75 degrees. In many cases, they're staying closer to 80 degrees or above. And we in New York, in the recent heat dome, we clocked a temperature at 87 degrees overnight, which is just incredible. So this is how the climate is changing in central North Carolina with higher humidity, higher overnight temperatures, or more persistently high overnight temperatures, which actually has a significant impact on people and our infrastructure. Almost every aspect of our society is impacted by this.
Ashley Ward, and Angel Shue are with us here on Due South talking about heat, extreme heat. And Ashley, I think I want you to go next level on that overnight note there, right? You say didn't get any lower than 87 recently in New York. I went to school in upstate New York. That's wild. But as we think about plants, as we think about bodies, as we think about the grid, like what is most important to understand about why that's a problem? Like, yeah, okay, it's 87, but like I'm asleep. Why should I care? What are the impacts there?
There's so many challenges with persistently high overnight temperatures, right? I mean, everything, as you mentioned, needs a reprieve. Our bodies need a reprieve, our plants need a reprieve, animals need a reprieve, and our infrastructure needs a reprieve. There's a couple of things here. We know that a lot of the more serious health outcomes are associated with high overnight temperatures. For example, our own work in looking at increases in preterm births show that overnight temperature has a more of an impact on preterm birth than even maximum daytime temperatures.
Wow.
So that they were definitely seeing disruptions in sleep, challenges with people who take prescription medications that make it hard for their body to thermoregulate. So if you have diabetes, if you take an anti-anxiety medication, if you take an antidepressant, these things interact and make it very hard for your body to recover, especially if you're not getting the cooling off at night. But I think almost equally as important is what Angel brought up at the top of the segment, which was air conditioning. What's happening is the moments when electricity is the most important for protecting our human health are also the moments overnight where the demand on the grid is the highest. And that is also when households may be least able to afford that electricity. And so the result of that is that people either ration their energy use so they don't turn their air conditioning on. Their air conditioner may not be sufficient to cool their house. It's older, whatever. So it's just this all to worst case scenario, right?
Yeah.
Of you have like an infrastructure that can't meet the demand, higher overnight temperature, and people who are struggling to adapt.
There's obviously a lot there, but I want to give you an opportunity.
Yeah.
What would you like to add to that?
Yeah, I was just going to say that when we look at the climate model, so I'm one of the scientists that's contributing to the big intergovernmental panel on climate change. We have a special report on cities and climate change that we're finishing up this year. It'll be sent to the governments in March and so hopefully approved. But what we're seeing with these climate scenarios is that future warming is going to make temperatures in the daytime and also nighttime even worse, and it's closing that gap. And so, as Ashley said, you would normally see pretty high daytime temperatures, and in the nighttime you would get this cooling off. But now we're starting to see that gap close, where daytime temperatures are starting to catch up with how extreme daytime temperatures can be. And in particular, some of the things that we would do to try to reduce urban heat within cities, such as planting trees. Some of our research in Durham has shown, particularly when we put low-cost sensors in Durham in the summer of 2024, that actually trees are trapping some of the heat that would have radiated back up to space in the nighttime, and they're trapping it and making our houses even warmer. And so that was a really surprising result for us.
Yeah.
Because you always think about, how do we solve the urban heat crisis? We should plant more trees. Trees can cool cities. And yes, they can during the daytime, but at nighttime, what our research is showing is actually those leafy areas that tree canopy is actually hanging on to some of that heat. And so it's actually reducing the difference between shaded and unshaded areas, those temperatures at nighttime.
Right. Seems counterintuitive,
Yeah.
but I mean, I hear you. I trust you.
Yeah.
What are the options? Are there other plants that are more conducive to helping during the day and not making things alleviating problems at night?
I don't think that research has been done yet.
Okay.
I mean, I think it's really about the density and the amount of leaf area that you get in a tree for this type of shading and cooling. And by all measures, you start to look at different recommendations for how we can address extreme heat within cities, and tree planting comes up as a number one solution. I'm not trying to knock trees. I love trees. Trees are really great.
Sure.
But just in relation to this question about nighttime temperatures and nighttime temperatures getting worse, that was a really surprising finding that we found in Durham, is actually under these shaded areas, particularly at nighttime, they're not cooling off as fast as you would in an unshaded area because some of that leaf
Right.
area is trapping that
Yeah,
heat.
no, I follow. Angel, you've done a considerable amount of research on the disproportionate impacts of extreme heat in cities. And if you want to use a different word, please interject it here. Like if you're not loving extreme, you want to use dangerous or something else, please just put it on the table. From your research, what are some of the most notable takeaways about this discrepancy with major cities and bigger cities?
Yeah, so this goes back to the first point we were talking about how these global changes actually mask the local differences and the local extremes.
Interesting. Okay.
And so that's why we need to look more closely within communities and cities and look at individuals and how they might be differentially affected by higher temperatures or extreme heat. So this can relate to things like age or gender, occupation, whether or not you live in cities or you work outdoors in rural areas. But then also our research has found that based on your income. So lower income households tend to be exposed to higher levels of urban heat and higher temperatures, and also whether or not you're an ethnic minority. And so we find that non-Hispanic white communities also happen to be exposed to almost a full degree and a half Celsius higher temperatures throughout major American cities than their white counterparts.
All right, let me pull on the. No, Ashley, jump in here. You have a thought.
Yeah, I just wanted to compliment what Angel's talking about. And, we focus a lot of our work on rural communities. And in North Carolina, the second most rural state in the nation, one of the things that's really complicated is that we actually see heat illness rates higher in rural counties than we see them in urban communities, and sometimes 7 times or more higher. And that's been a trend that we're seeing across the Southeast. And it's getting worse, I think, as we see manufacturing and other kinds of indoor occupational heat exposure moving into rural communities where land is cheap and labor is cheap. But rural communities struggle and they don't have the same set of tools in the toolbox as we see for some urban heat interventions.
Heat illness disproportionately higher in North Carolina. My mind goes to the most rural part of our state, which is the eastern part of the state, which is at low elevation, which is extremely hot in the summer. Either push back or run with that, and please go next level, Ashley.
Yeah, no, the Sandhills region in particular in and North Carolina is of high risk. I mean, one of the issues and the challenges remains the fact that we have some of the similar issues that we see in urban communities like older housing, access to affordable energy, but access to many occupations in rural communities are not in air conditioned buildings or office buildings. There's a lot of manufacturing in rural areas. People tend to automatically go to farming, and actually farming is not where a lot of it is. It's happening in from delivery drivers and food service workers and food processing plants and all kinds of other manufacturing that's in rural areas. We also have mobile homes that are in higher density in rural areas than in urban areas, which, historically also have a challenge with keeping cool. And whenever the power outage, in the summertime, if you're from North Carolina, you'll know exactly what I'm about to say, which is in the fall or late summer, you see thunderstorms roll through North Carolina, from the heat, dissipating some of the heat. And, energy providers, when the power gets knocked out from these very typical thunderstorms,
Right.
are going to prioritize restoring energy in more densely populated urban areas. No problem with that. Totally understand it. But what that means is in rural areas, their times to restoration are considerably longer than what you see in urban communities. And so what is like a normal thunderstorm event that's not anything that's extreme can knock out power for 12 to 24 hours. And now you have a real emergency on your hand for those people who are during heat season, who are living in those communities.
Ashley Ward and Angel Shu are with us here on Due South. They are scientists. They are, I'm going to call you climate experts. You can push if you're like, no, you're not. But you study weather, you study climate. We are getting a much better and deeper understanding of the heat that we often experience in the summer, and also how it has changed across generations here in central North Carolina and beyond. I want to pull on a couple of words I've heard here recently: income, access, I did not grow up with air conditioning. Mind you, I didn't grow up in this part of the country. I grew up in Massachusetts, and you didn't need it for the most part. But there were a couple weeks every year where it was a scorcher. We had one window unit, and Dad would get it down from the attic and put it up in my parents' bedroom, and my sister and I would sleep on the floor when it was that hot. I'm interested if either of you can quantify how many of the 11 million plus people in our state don't have air conditioning. Do we know that data, Ashley?
We've actually just published, one report, and we have another one coming out later this week that talks about energy affordability, and it relates to this issue of access to air conditioning. You might see a lot of, especially national reporting, that shows that nearly 100% of people, 97% of people in the Southeast have air conditioning. I think that's misleading because, first of all, there are many people in the Southeast who do not have air conditioning at all. It also doesn't distinguish between people who have that single window unit like you're talking about or central air conditioning. It also doesn't take into account whether or not a person can afford to run their air conditioning or if the air conditioner they have is sufficient enough to adequately cool where they live. And the cost of energy, everybody in this country is talking about the cost of energy right now, how utility bills are going up and everything else. One of the things that we have to keep in mind is the consequence of increasing energy bills are that the most at-risk households then are put in a position where they are rationing their energy use, even in these very serious conditions. About 30% of all U.S. households are energy poor. In 2022, which is the last data we have available, about 40% of those in rural areas, about 29% in urban areas. So having an air conditioner and being able to afford to run it are two entirely different things. And we have to hold both of those at the same time.
Yeah. And I would just add another consideration is the quality of housing as well. So lower income communities also may be renters. And so they may not have control over their air conditioning. And so some landlords might actually ration how much their tenants can run the air conditioning, or they put a limit on how much they can spend in terms of their total utility bill on air conditioning, in terms of the quality of housing. Some of them, if they are in informal housing or manufactured housing, then they may not insulate as well. And so even if you are running the air conditioning, it may not cool as effectively as if you had a different type of home that was better insulated.
Two quick follow-ups before we come up on a break. Number one, is air conditioning required in the state of North Carolina? Do landlords have to provide it for tenants?
No.
No, they do not. All right. Number two, if you would, either of you in 30 seconds or so, you just used a phrase. I'd love for you to define it. What is energy poor?
Sure. So energy poverty refers to the inability to afford running your air conditioning, or running energy. It could be for heating too. The affordability threshold for a household is about 6% of your household income. That's the affordability threshold. So what we're really referencing here is the difference between actual home energy bills and when those exceed the affordability limits.
Yeah, and I would just add that nationwide, about 20% of households fall below that particular threshold. So they're spending about 6% or more of their income on electricity. And that actually, there's a lot of differences more locally as well, but between different states. And so you can have some states where that that percentage of households can actually be much higher than 20%.
Ashley Ward and Angel Shu are with us here on Due South, chatting about heat, extreme and dangerous layers of it, and we'll continue our conversation in a moment right here on Due South on WUNC News. It's Due South on WUNC News. I'm Jeff Tiberii. We're spending a good chunk of this hour with Angel Shu, UNC Chapel Hill professor of public policy and environment, ecology, and energy, also director of the data-driven EnviroLab at UNC Chapel Hill. Also joining us on the line is Ashley Ward, director of the Heat Policy Innovation Hub at Duke University's Nicholas Institute for Energy, Environment, and Sustainability. We're talking about some of the heat factors on our mind that we're experiencing and how we individually and collectively can cope with it. I'm going to share an embarrassing story, and then hopefully we can talk about heat index. I recently went on a run, like 4 to 5 miles. It was so hot, and it was so humid, and I sweated so much that my wireless headphones got so they don't work anymore. This happened, and I've run with them before. I was like, God, what is these are good headphones, and they're gone. The heat index for me, when it gets to the upper 90s and it reaches triple digits, it's like, all right, I ought not run 4 or 5 miles unless I'm doing it early in the morning. I've read that there were 25 days in 2025 in which the heat index hit triple digits. From your seats, I'm wondering when it's dangerous. If you have, and I hear you on it can vary a little bit, but is there a general threshold where you're like, all right, this is dangerous? And how do you track it? If you track heat index by days or by hours, Angel?
Yeah, so you're referring to a heat index, which is communicating the fact that it's not just air temperature alone that signals the danger of heat. And so normally a heat index will combine humidity. And as Ashley mentioned, in the South, what is really dangerous about heat is the combination of the two. And so you may get the air temperature reading, which is normally what you can get on your phone or weather station. And so even a temperature of only 90 degrees, even though that doesn't sound that dangerous, when combined with humidity can be over 100 degrees. And so generally, I think, but it also depends. And so the reason why it's really difficult to say, is this dangerous for me, is because it totally depends. It depends on, do you have underlying health conditions where it might make you more susceptible and sensitive to higher temperatures? Are you in a particular occupation where you're working outdoors? Are you an athlete like yourself where you're running outside and doing a lot of activity outdoors? And so and it depends also locally. So different governments, and I'm sure Ashley can speak more to this, different governments or cities, they may have different thresholds at which heat alerts actually get activated. And so sometimes those could be when a heat index is at 104 degrees or 106 degrees is often when you start to hear these heat alerts being activated. But it's locally specific and determined by a particular government. So just as an example, last summer I was in the Netherlands and they start to activate their heat action plan in Amsterdam when temperatures reach 35 degrees Celsius, which is not even 100 degrees Fahrenheit. And so it depends on where you are and what baseline adaptation and adaptive capacity people have. Like, are they used to the fact that when it's really hot outside that I need to take protections, I need to make sure I stay indoors, I need to run my air conditioning? Or like in European cities, I was in London a couple of weeks ago during that heat wave, and it was unreal. I mean, I have never experienced anything like that in my life. And they had temperatures that were over 100 degrees, and that was unusual for them.
But and I just want to underscore this. I've been to Las Vegas in July. I've felt 117 degrees, which is brutal. But you're saying this is, but you're saying it's worse because of it's not just this dry heat.
That's right. It's also humidity, and that was what I was facing in London. And their infrastructure is not air conditioned. So I was on buses, I was on the tube, I was in museums, I was in conference spaces. I was staying at a friend's flat. He lives on the 8th floor of an apartment building.
Don't tell me it was walk-up.
Well, no, he has an elevator.
Okay, good.
But there was no air conditioning. And so there were the temperature inside his apartment in the evening was 85, 87 degrees. And there just frankly was no break, no relief from the heat. And so I also say take these heat indices with a grain of salt, because obviously they're not necessarily determined for an individual specific situation. I mean, they're more general to try to raise awareness of heat and temperatures. But one of my PhD students did a paper last year where she looked at the effectiveness of heat alerts. So when temperatures reach a certain threshold and governments then signal, they send out text messages or they issue a service alert on the weather station. And what we actually found is that they're not that effective when they're issued on the day of. And so it's difficult for people to modify their behavior when they hear a heat alert. It generally takes a day or two where we actually start to see the protective effects of people saying, okay, well, maybe I should keep my children indoors, or I should modify my plans or choose not to garden at certain times of day, these kinds of things.
I don't believe you're a social scientist, but go a little bit deeper. I mean, is that just because we can't be inconvenienced? Like, well, oh, damn it, I had a thing I was going to do today. So what if it's 108? Like, is that what's happening with the psyche?
I think that could be part of it. And as you mentioned, I'm not a social behavioral psychologist. And once we got the results, we started to hypothesize and theorize, well, what could be some of the reasons why? And I think it is about this behavioral plasticity, as a behavioral scientist might say, is that it's really difficult in some cases to modify your behavior. And so that's why we have to look towards governments, particularly local governments, to say, okay, well, we need to modify work schedules. So the city of Raleigh, for example, does that. So when there's particularly high heat days, they may modify, for example, waste management or trash collection services so they're not collecting trash and they're not doing routes on the hottest parts of the day to protect workers.
Ashley, I want to talk about agriculture in a moment, but build on this solutions path of our conversation, if you would. What are some other things that are being implemented or talked about, or even if it's theoretical and you're like, this is where we need to be a few years down the road?
So I want to give a little bit of a shout out to the state of North Carolina because we really are a leader in this space. And you might not know these things that are happening, but the state of North Carolina has a heat alert system that is based on health outcomes. So we help set the thresholds based on when people start going to the emergency department. And as Angel just said, this is usually a lot lower temperatures than what you might see from the National Weather Service warnings. The National Weather Service warning is based on the probability of the event itself. It is not at all related to when people get sick. In North Carolina, we said, okay, all right, let's look at when people are going to the emergency department, when we start to see those visits peak. And actually, it starts to increase at low 90s, so much lower, many degrees lower than what you might see from the National Weather Service. But it's also regional. And it's also seasonal. Is it early heat season, mid heat season, late heat season? Are people already acclimated? And so what we did with the state of North Carolina is set thresholds based on all of their criteria. So North Carolina actually has one of the few outcome-based, seasonal early warning systems, heat alert systems in the country. There's only a handful of states that do this. In addition, I'm going to give a shout out to Autumn Locklear at the DHHS, who's the epidemiologist there in the environmental health lab, who sends out a weekly heat report so that you can track who's going to the emergency department. It's incredibly interesting. And all of these things are free to anybody to sign up to if you go to the DHHS website. And so you learn a lot of interesting things. Early in the season this year, we saw a lot of older males showing up to the emergency department. People have their tea times and it's 2 p.m. or whenever
you're referencing golf, to be
and
clear. Yeah.
And, so we have this event happening, but, they're going to go play golf with their friends. I think one of the things that they're going to mow their grass. They're not going to change their behavior to what Angel was just talking about. It takes time for people to reschedule their life and do these things. If you're a school system or if you're an athletics team and you have something scheduled, parents have to get off work, arrange alternative transportation for their kids. I also want to point out that it's not easy to shift work schedules. Mm-hmm. People a lot of times talk about this, but just one really quick, very practical thing is many municipalities have noise ordinances. That means that if you are a construction firm and you want to be able to do shifted work schedule, if your local municipality has a noise ordinance, guess what? And so I think this is just pointing to the fact that we have not aligned our systems across to respond to this. Perhaps the way to do that is to say, yes, there's a noise ordinance. However, if we have dangerous heat in the forecast, we lift the noise ordinance in order to allow shifted work hours. That's not a consistent thing that happens across the country and certainly not across North Carolina.
Let me remind listeners, Ashley Ward and Angel Hsu are with us here on Due South for a few more minutes. Ashley, you're talking about these efforts, this report that comes out weekly. I'm wondering if we've got the data for it, are there fewer hospitalizations? Are there fewer deaths as it pertains to heat in North Carolina relative to other southeastern states?
Well, we just launched the heat alert system last summer, and I know that our friends at DHHS are tracking these and trying to figure out what the impact, the efficacy of the heat alert system has been. This has largely been an effort that's supported through the CDC BRACE program. One of the things that we've talked about in the state is right now it sends out an email alert when there's high heat in the forecast. One thing that we've talked about doing is whether or not we can text message this, but these types of systems require investment from public policymakers. I mean, in almost every circumstance that we've talked about today, it requires some kind of action and investment, whether it is thinking about what Angel talked about urban heat and design, that intersects with all kinds of building codes and zoning. whether we talk about whether or not our electrical grid is ready to provide affordable cooling to people's homes. This is something utility commissions regulate,
Right.
along with investments from the private sector. When we're talking about heat alert systems, these are things that the public sector has to invest in. Opening cooling centers, getting word out, providing water stations. All of these things are a use of public funds that have to be first allocated for the public to use them. So there is no way to separate policy from the things that we've been talking about today.
I do hope that I'm going to come back to you and ask about agriculture in a moment. This is my plan, but the clock is working against me. Angel, I want to ask you before we run out of time. You mentioned you've been to Europe. You also do some work with some folks in Singapore.
I lived there for 6 years.
Well,
before I moved back to North Carolina. Yeah.
Tell us what the takeaways are and what they are doing there on this front, please.
Yeah, so Singapore is a small city state. It only has a population of less than 6 million people. And so what they're able to do in that size area, I mean, I don't know exactly, can't remember off the top of my head exactly how big in terms of square miles Singapore is, but frankly, you can drive from one end of the island to the other in about 25 minutes. So it's that small. And because they're located at the equator, they deal with temperatures on average between 85 and probably 90 degrees. I mean, it's a pretty narrow range of temperatures, but it's incredibly humid. So we're talking about greater than 80% humidity on a given day. And so it's a matter of existential existence for them. It's a matter of life and death. And so they have really invested a lot, exactly as Ashley said, urban design and really smart planning and thinking about warning systems and how to also nudge behaviors in certain ways and to design working hours so that workers are not placed at greater risk during high temperatures during the day. But even things like one of the malls that was in one of the neighborhoods close to where I lived was designed in a way where they didn't have to cool an entire indoor space. So we're talking about probably like a 5,000 square foot mall, and the inside of it was essentially open. And then it had a tunnel running through the middle of the mall to allow for constant airflow without the need for air conditioning. And anywhere you go in Singapore, if you're walking and taking their fabulous public transport, they have covered walkways to protect you from the sun, but then also from rain, because they get a lot of really torrential downpours that will just come out and sneak up from you from behind. And so, yeah, they're really doing a lot of stuff and really thinking about how to innovate and how to design for a warming planet and to combat extreme heat.
That's fascinating. Just to contextualize it briefly, Singapore, thank you, Google, is 287 square miles, which is about twice the size of Raleigh's square mileage of 149. So not a large place, to your point. Angel Hsu and Ashley Ward with us here for, unfortunately, just a few more minutes on Due South, learning a lot about climate and weather. I want to ask about agriculture, Ashley. We don't have a ton of time here, but this is a major industry in our state, and you've written about economic loss and reduced yields due to excessive, extreme, dangerous heat. Tell us a little bit about that, please.
Sure. Of course, and I completely understand when we think about ag and heat, we automatically go to worker safety, and as we should, right? It is a big issue where we have, limited solutions. Some crops cannot be harvested at night. The dew gets on them and it causes increased rot, for example. So the shifted work hours doesn't work as well. A lot of people say, "Oh, we just harvest things differently." That's not exactly how it goes. And so we do have a group of workers who are quite vulnerable and at risk to heat. Additionally, though, what we're seeing is increasing claims on our crop insurance, USDA's crop insurance program. So a lot more indemnity loss due to heat. Heat is driving some of the drought losses, which are enormous, and also contributing to wildfire. So heat is a contributor. Our comms director likes to say it's the least lonely event. It really is. It really does contribute to these other things that significantly impact the ag sector. We're also measuring reductions in chill hours. So this is off season when it doesn't get cool enough for many hours. What happens is that particularly fruit and nut crops don't produce the same amount of yield. We see reductions in dairy farming, egg production. There is quite a bit of issue with livestock, cattle, hogs, poultry. So, I mean, there isn't an aspect of ag work that heat is not impacting.
If you would, in our final moments here, you mentioned ordinances earlier as it pertains to construction work. What is a change that could be implemented for agriculture workers that would be beneficial in the face of heat?
Well, in what you mentioned earlier is that we do not have a cooling standard in the U.S., which means that farm worker housing, but also schools, prisons, elder care, none of those things are required to have cooling. I think, if you're thinking about the federal policy level and even the state policy level, thinking about those kinds of policies would certainly help. However, is that feasible in this policy environment? I think less and less so. So the alternative is that we really think about how to work very closely through ag extension with farmers to help them figure out low-cost solutions to reduce the impact of heat on workers in the moment. And we can get great lessons from the U.S. military, who spends lots of time thinking about this. Arm immersion is a technique that is commonly used in the military during training to reduce the impact of heat on our service members. It's an easy translation, low-cost solution to farm communities, providing shade, increasing rest time, and enforcing those. A lot of people say, oh, we need to enforce these things. We don't have the staff to enforce it, though. So we have to think about making the case directly to the farmers about why it is in their best interest to implement these safety measures.
Ashley Ward is the director of the Heat Policy Innovation Hub at Duke University's Nicholas Institute for Energy, Environment, and Sustainability. And Angel Hsu is director of the Data-Driven Enviro Lab, also an associate professor of public policy and environment, ecology, and energy at the University of North Carolina at Chapel Hill. Thank you both for being with us today.
Thank you so much for having me.
I'm Jeff Tiberii. You've been tuned in to Due South on WUNC News. We'll talk to you again tomorrow at noon.
Each story you hear on Planet Money starts with a question. What happens if we refund tariffs? Why are groceries so expensive? At NPR, we stand for your right to be curious, because the forces shaping our world can be hard to see. Follow NPR's Planet Money wherever you get your podcasts and start seeing how the economy really works.